Hello everyone, I'm Dr. Pradeep Sinha and I'd like to welcome you all to the Atlanta Institute for Facial Aesthetic Surgery and to our virtual event. Be sure to stay with us till the very end where I'll be doing a live Q&A, and as a thank you to all of you for participating, we'll have a very special introductory price for all of you. So we do a lot of different hyaluronic acid-based fillers here, but one of the reasons I really like Teoxane is the resilience of the filler. There's lots of parts of your face that move, and it's important that a filler moves along with you. So what Teoxane does is when you fill around the mouth or places where we have a lot of movement, the filler stretches along with your face and then comes back to its original shape and form. So we do a lot of different fillers in the office, and I think Teoxane adds another dimension of efficacy as far as having a filler that's a little more resilient, and this just helps us give more treatment options to patients. So fillers really help us in parts of the face that are devolumized, where we create concavities and fine lines. So I think this filler is just another good filler in our armamentarium, especially in places around the mouth and other areas of high mobility where the resiliency of the Teoxane will help us. So a good candidate for this treatment is anyone who's desiring improvement in facial revolumization, plumping areas for enhancing their appearance and getting rid of fine lines. I think especially people that have fine lines around the mouth are in particular good candidates for Teoxane.
Well, I'm getting married.
Good, congratulations.
Thank you, at the end of October, and I'm looking to see if we can fix a couple of things. My face is kind of sagging a little bit here. I just want to look refreshed for my wedding.
Okay, well I think we can do that for you. Right here underneath your eye, you're losing a little bit of volume, and that's creating what we call a tear trough. You can kind of see a line forming here. Mm-hmm. Your cheeks are actually flattening a little bit right here. This part of the cheek is very important in kind of holding this part of the face up. You see when I just give a little lift here, the eye and the fold down here just improves. Of course you have this fold right here that's forming, and then if you can see also the corner of your mouth is starting to turn down a little bit and losing a little bit of volume right in this area. So these are all very natural places, right, to lose volume. You know, our face has all these little fat pads, and the fat pads are like little air pillows. But what happens is as we get older, they start deflating, and that's what's creating the lines and the shadows on the face. So the nice thing is we have these nice fillers that can actually restore a lot of the volume to these areas, bring the face back to the way it was when we were, younger.
I know.
A few important landmarks that we look for when we're doing the face. One is what part of the cheek do we want to inject. So if you don't inject it right, people will look funny. They won't look natural. So what we do is we can make zones of the face. We make a little line this way, and we can make a line this way, right? And sometimes people do it to the nose. This is the zone you want to inject in right here. You can see the cheek mound right here, the cheek prominence. And so that's kind of where we want to fill. There's another area, this is called the anterior cheek area, and sometimes people are sunken in here, and that's the second area that you want to inject in. Right here, maybe we'll do it on this side. You can almost see this triangular deficit right here, and this is really where the fat pad is sinking on this side. And it's very important not really to inject the line, but to kind of reinflate this area to kind of help fill that out and build that line up. And then finally we have this tear trough area right here, kind of the line that comes like so, and you can see really the depression is right here. If you're able to fill that out, you can see just like that how the whole thing comes out and the line pretty much disappears. So we have a couple of different choices of teoxane fillers. Clearly you can see numbers 2, 3, and 4. Kind of goes from thin to thicker. And I'm just feeling for the junction of some bones here. Gonna lift it a little bit, and then we're just gonna go right up. Give her a little injection. 1. Okay. 2. So the next step, we're actually gonna lift this out a little bit. You're gonna feel it. 1, 2, 3, tiny little stick, and then go ahead and inject it. So now what we're gonna do is we're gonna inject a little more right here underneath the eye to really lift it up, kind of giving her this. And for that, we're going to use something called a cannula. So a cannula is blunt on the tip. There's no sharp edges here. This area has a lot of blood vessels, so a cannula is just a great way to kind of get filler in this area without creating a lot of bruising or bleeding. So the way we actually get the cannula under the skin is we just make a tiny little pinhole right here. And we're just going to boop, just tiny. That'll help us get in. I'll do this now. Okay, so what we do is, you can see kind of our little hole right here, and we just kind of slide the cannula in there, and here we are. Now we're under the skin, and go right on top of the bone, slide my cannula in there, and then I can start giving her some fill. You can see right here it's starting to fill up. Filling up, I'm coming out slowly. And there we go. Just a little more. You can kind of see the edge of the needle or cannula right here. And this is a great spot for these HA fillers. This, of course, is off-label. RHA 1, I believe, that's going to come to the market, I hope soon, does have an indication for under eye fill, I believe. We'll know when we see it. But for right now, we're doing, it's called an off-label indication. But you can see right here how we filled up this whole zone right here, and we're able to do it with almost no bleeding or bruising. So you can kind of see here, depression, sagging versus here. You can see how this whole area is filled out. There's no more depression, no line or anything. First of all, we've reestablished a nice cheek volume over here, and lifted up this little shadow over here. So you can see that she doesn't have much of a line here. This nasolabial fold is kind of out, almost like we lifted the whole thing up. And then the corner of the mouth is lifted here versus here. So let's take a look. See this cheek, see how flat it is right here, and see how she still has this depression and this little line. She also has this nasolabial fold, and the corner of her mouth turns down. This is on the uninjected side, this is on the injected side. So thank you everybody for taking the time to attend this virtual event. Just as a reminder, there will be a special introductory discount for everybody that took the time to participate. So I will make myself available to chat with anyone who has any questions by submitting questions in the question box.